vous entends. Vas-y.
OK. Donc, je vois que ça y est, ça vient d'être ouvert.
Oui,
Excellent. Les interprètes sont en place aussi.
oui,
Je peux
tout le monde.
confirmer. Très bien. Okay. Okay. Oh, we're going to let just a minute or so people can connect. So just bear with me one additional minute before we get started.
Vemos uma causa e a proliferação de estabelecimentos de vendas da conta de
Dr. Lina just joined us. Maybe we can mute her for the time being.
Devia se melhorar a coordenação, o Comitê Municipal de coordenar a todos os níveis, essa ação e o ponto de
Okay, to my clock, it's getting to 5 minutes past 10. So, bonjour, bon dia, good morning, or good afternoon from wherever in the world where you are joining us today. And thank you to all the participants for joining us to this important webinar. So we are so pleased to see so many of you. Last time we checked, we had over 278 people who registered, and as we're counting, we are over 64 now online, hoping that those who are trying to connect will join us very soon. And these participants are coming from over 50 countries in the world, so this is a very good way to get started. For those who don't know me, my name is Patrick Teixeira. So I'm the Director ad interim of the Regional Center of Excellence Against Hunger and Malnutrition. And I will be serving as your moderator today. What are we going to talk about today? Financing human capital development. It's about strategic partnerships, policy levers, and innovative investments for nationally owned school meals programs. This is the second webinar of a series that the SERFAM has been promoting called The Power of School Meals, carrying forward the momentum amidst the global crisis. And the series of webinars really aims at putting the spotlight on school feeding to highlight the journey of school feeding, especially over the last few years. As you know, the world has been in trouble. Many crises, we call that the poly crisis, and education, school meals have also been affected. Let me remind you a few of them. One of them is the COVID-19 pandemic that led to close the school. The second one is the impact of the Russian-Ukraine war, which led to a rise in the price of food, fuel, and fertilizers, of course. Not to mention climate hazard, which continues to exacerbate, of course, the hunger situation. Within this context of overlapping crises, the second webinar seeks to showcase the fundamental role of school meals as a key platform for human capital development. School meals and finance in ways to highlight what are the current financing challenges national governments are facing to fund education, to fund health, to fund good nutrition for their populations, and what are the various opportunities that do exist to overcome these challenges, and this through partnership, innovative and smart financing, and policy levers. Just a few housing key rules before we get started. I would like to let you know that interpretation services are offered in French, English, and Portuguese. So please join the language of your preference by clicking on the interpretation button that you will find on your computer. And throughout the session also, let me remind you that you can ask questions through the chat box, quick question and answer Q&A, and I'm pretty much sure that the panelists today will have a pleasure to answer to those questions. So before we begin to listen to the panelists, I'm going to invite Dr. Babatunde Omilola, Manager for Public Health, Nutrition, and Social Protection from the African Development Bank. Dr. Babatunde Omilola is an international development expert and head of the Public Health, Security, and Human Development Division of the African Development Bank Group. He is responsible for managing the AFDB multi-billion-dollar response to the COVID-19 pandemic to save lives and livelihoods throughout Africa. So a global leader, Babatunde served as head of development planning with UNDP in New York and led the United Nations Interagency Task Force on the monitoring and implementation of the Sustainable Development Goals globally. He also co-chaired the United Nations Secretary General High-Level Task Force on Global Food and Nutrition Security Technical Team. Babatunde worked also as an Africa-wide coordinator with the International Food Policy Research Institutes. So he has visited and delivered development assistance in over 80 countries worldwide, in Africa, Europe, Middle East, Asia, and the Pacific, Latin America, and the Caribbean. Wow. We are very pleased to welcome you, Dr. Babatunde. And Dr. Babatunde is going to explain to us some of the key themes of this webinar, what we're going to touch upon. But all of you are wondering, what is human capital development? And what are the linkages between human capital development and school meals? What are we talking about when we talk about innovative financing mechanism? What are strategic partnerships and policy lever? And what is the African Development Bank doing, has been doing, and is doing in this space to advance human capital development? So, Dr. Omilola, the floor is yours. Thank you.
Thank you very much, Patrick, for that really excellent opening remarks as well as introduction. Excellencies, ladies and gentlemen, I'm extremely delighted to join you today on behalf of the African Development Bank. For me, I would like to first and foremost convey my gratitude to the government of Cote d'Ivoire, the Regional Center of Excellence Against Hunger and Malnutrition, as well as the World Food Program for organizing this webinar series, which is very timely. Now, health, nutrition, education, and economic securities are all interconnected as pillars of human capital development. As we all know, the COVID-19 pandemic forced us to reckon with our society's ability to address critical and interconnected challenges that threaten us all, especially in many of our fragile societies in Africa.
Oui, bonjour.
Can we mute the microphone, please? Due to the COVID-19 pandemic, Africa was exposed to the vulnerabilities of the pandemic, particularly in the sectors of health, education, and social protection. To put things in perspective, the COVID-19 pandemic found Africa with a very weak healthcare system, characterized by huge healthcare infrastructure deficits. In January 2020, as the health crisis evolved into a global pandemic, Africa had an average of 1.3 hospital beds per 1,000 people. As we speak, a third of Africans live more than 2 hours away from health services, and only half of the primary health facilities in sub-Saharan Africa have basic water and sanitation services, while only 1/3 have access to reliable electricity. Poor health undermines economic productivity across all sectors, which cost Africa an estimated $2.4 trillion annually. If known health interventions were applied in Africa to reduce the disease burden, GDP growth could be increased by 0.5 percentage points per annum across the continent over the next 20 years. We can all agree that Africa faces major deficits, particularly in financing health infrastructure. The $4.5 billion in capital expenditure currently being made by African governments each year is far below the estimated $26 billion in annual investment needed to meet evolving health needs over the next decade in Africa. Donor support for health infrastructure has also been declining steadily in recent years, and there are major gaps in the support available for new secondary and tertiary health infrastructure in Africa. On the other hand, the most significant factor that contributes to diseases and poor health worldwide is inadequate nutrition, which also happens to be the primary cause of child mortality. There is no better representation of a tragedy than the unrealized human potential of a child who is stunted because of malnutrition. Africa is one of the regions with the highest proportion of stunted children. Despite our regional and national efforts to tackle malnutrition, close to 40% of the world's stunted children lived in Africa as of 2020. Stunted children grow up to earn 20% less in average wages compared to their normal counterparts. At the macroeconomic level, estimates show that poor nutrition leads to about 11% GDP losses per year, stemming from increased healthcare costs, high school repetition rates, as well as lower productivity. Furthermore, malnutrition is likely to escalate due to the COVID-19 pandemic, the climate change crisis, as well as the ongoing war in Ukraine. Of course, what we refer to now as the polio crisis that the world is facing, all of which have, of course, led to a strain in food production and an associated rise in food prices. However, the prevalence of malnutrition has not been matched with financial allocation despite promising return on investments. Only 11 countries in Africa have a dedicated budget line for nutrition. When it comes to school feeding programs, the World Food Programme reports an interesting phenomenon. At the beginning of 2020, prior to the COVID-19 crisis, national school feeding programs delivered school meals to more children, an estimated 388 million children than at any time in human history, making school feeding the most extensive social safety net in the world, reflecting a widespread institutionalization of these programs as part of government policies for national development. This progress was unfortunately derailed by the COVID-19 pandemic, which resulted in 199 countries closing their schools, and 370 million children were suddenly deprived of what for many was their main meal of the day. The need for social protection is greater in sub-Saharan Africa than in any other region in terms of the depth of poverty and the range of vulnerability factors. However, just like health and nutrition, there is a significant underinvestment. The level of average social protection expenditure exclusive of healthcare compared to GDP in Africa is 3.8% compared with the global average of 12.9%. Ladies and gentlemen, it's not all doom and gloom. Gaps unveiled are opportunities to fill. We have the evidence. What is needed is the innovative financing mechanism to support health, nutrition, and education.
Please proceed.
We have the evidence. What is needed is innovative financing mechanisms to support nutrition, health, and education as human capital development drivers to strengthen and secure our economies. This brings us to the topic in discussion today. What is the financial landscape and how can it be utilized? Who do we need to work with, and where can we double down our impact? Let me mention that at the African Development Bank, our board approved a $10 billion COVID-19 crisis response facility to save lives and livelihoods in Africa, but also to stabilize African economies, as well as to lessen the social and economic impacts of the pandemic in Africa. We also launched a $3 billion social bond to deal with the COVID-19 pandemic, which of course has been applauded globally as the largest dollar-denominated social bond on the international market as at that time. From the African Development Bank, we remain fully committed to inclusive growth that transforms the continent. In terms of our priorities, we have what we call the I5 priorities, and some of them are particularly related to the human capital development trajectory of the continent, especially our I5 priority on feeding Africa, as well as improving the quality of life for the people of Africa. Now, let me mention that at the African Development Bank, we promote innovative financing mechanisms that can help mobilize resources and attract private sector investment to support human capital development initiatives in Africa. And I will give you a few of these examples. In February 2022, the board of the African Development Bank approved the first ever strategy on health, which we refer to as the Strategy for Quality Health Infrastructure in Africa, to support our regional member countries in their efforts to accelerate the development of quality health infrastructure in Africa, with a commitment of up to $3 billion for healthcare infrastructure in Africa between now and 2030. At the same time, the bank has also prepared an action plan for pharmaceuticals, which we are also making a commitment of additional $3 billion between now and 2030. As you will recall, Africa is importing 70 to 90% of all its pharmaceutical goods. At the same time, Africa manufactures or produces only 1% of the vaccines that it consumes. And so this becomes extremely important in this area. The bank, of course, has now come up with different projects that we are looking at to finance in terms of the healthcare infrastructure strategy that has been approved by the board. And of course, in terms of the focus of the bank on healthcare infrastructure, it is for the bank to support and expand primary healthcare infrastructure, secondary healthcare infrastructure, tertiary healthcare infrastructure, diagnostics health infrastructure, as well as digital innovations in health sector, including, of course, promoting regional collaboration on shared health challenges in Africa. To demonstrate the commitment of the African Development Bank in combating malnutrition in Africa, the bank unveiled the Multi-Sectoral Nutrition Action Plan in 2018. This plan was aimed at scaling up the proportion of investments that are nutrition smart in priority sectors, including agriculture, water, sanitation, social, and health sectors. The plan aims at leveraging an additional financial resources through nutrition smart investments across these key sectors in order to be able to support a 40% stunting reduction across the continent by 2025. These sectors were identified since they account for over 30% of government spending in Africa and are underlying drivers of nutrition. To date, the bank has allocated close to $2.8 billion of its investment portfolio to be nutrition smart, from a baseline of $0.7 billion in 2018. This investment is broken down in terms of our investment in health, which is about $531 million, investment in agriculture, about $950 million, investment in water and sanitation, about $650 million, and investment in social protection, about $605 million. Through the bank's operations, and especially in the rollout of the bank's Multi-Sectoral Nutrition Action Plan, the bank has also been supporting school feeding programs. A good example is what we are doing in Ethiopia through the multi-sectoral approach for stunting reduction project, which is supporting homegrown school feeding interventions in selected parts of Ethiopia. Another example is through our project in Mali, which we started implementing in 2014 to provide nutrition interventions, especially in terms of school feeding programs. Another good example is our project in Sao Tome and Principe. In addition to all of these school feeding programs, the bank also launched what we call the African Leaders for Nutrition Initiative, ALN, through which we are amplifying the voices of African heads of state, as well as finance ministers and other key stakeholders to be able to catalyze more investment for addressing malnutrition in Africa. As a result of this, the bank, in conjunction with the African Union, launched what we call the first Continental Nutrition Scorecard, which of course was approved at the level of the African heads of state in Addis Ababa in February 2019 on the margins of the African Union Summit. Let me conclude, Excellencies, ladies and gentlemen, by saying that the bank recognizes that to achieve sustainable inclusive growth, the continent must develop innovative policies and programs that mobilize revenue to finance the same. Financing health, nutrition, and social protection are three different kinds of mechanisms that can really help the continent to reduce the burden of out-of-pocket expenses, especially among poor households, and ensure access to basic foods that people really need, especially our children. In addition to innovative financing mechanisms, global perspectives are also essential to support African countries in strengthening social protection systems. And at the African Development Bank, we are currently working on our first social protection guidelines that would also help us to really support the poor and the vulnerable throughout the continent. It is crucial to recognize that investment in human capital development and social protection systems in particular is not only the right thing to do, but it is also crucial for sustainable economic growth and social progress. By investing in these areas, we can unlock the full potential of human capital and build a better future for all. The African Development Bank will continue to work with all stakeholders to develop and implement sustainable solutions that can ensure that all Africans, especially the young population of the continent, have the opportunity to reach their full potential. So, ladies and gentlemen, we want to thank you so much for this opportunity, and we look forward to working closely with all stakeholders. Thank you very much.
I think, Patrick, you are muted.
Thank you, Dr. Amilola. Sorry for being muted for some time. So it's a pleasure to hear from the perspective of the African development banks, but particularly all the initiatives that you've been able to deploy across Africa in so many examples to tackle what you have called the poly crisis, and really to show the cost of inaction has on nutrition, the cost on the economy of people. So the support on innovative financing mechanism to African countries will definitely go a long way in strengthening their health and social protection system, but also stabilize their economy and alleviate the economic and social impacts in response to the interrelated crisis. So this is very clear. The African Development Bank has a renewed commitment towards supporting these programs, so supporting countries really getting to the next level. So thank you very much for setting the stage. And as we're moving now to the panelists that we'll have to hear from, I would like to welcome Mr. Kevin Watkins from the Sustainable Financing Initiative, SFI, within the School Meals Coalition, so chaired by the Education Commission. Mr. Watkins will focus on the states of financing school meals. Mr. Watkins is the research lead, as I said, of the SFI initiatives, and He's currently a visiting professor of practice at the London School of Economics. Previously, he led Save the Children UK as the CEO from 2016 to 2021. And before that, Mr. Watkins was the executive director of the Overseas Development Institutes, ODI. It's really an honor to welcome you so we can have a better idea of what is the state of financing school feeding. And there is a say that goes this way: don't focus on money. Instead, focus on the problem that needs to be solved, and money will follow. Is it the case for the school meal initiatives? Over to you, Dr. Watkins.
Patrick, thank you. And that's a great way to open. I think the honest answer to the question is not always and not enough, as in not enough money is directed to purposes that could really drive change. Patrick, maybe I could just start by stepping back. You asked a great question right at the beginning. What is human capital and why is it so important? When I think of human capital, I always go back to Amartya Sen's definition, actually. And human capital is ultimately about people having the health, the education, the confidence, the learning they need to make choices in their lives. And these are precisely the capabilities that countries need as well. In labor markets that are increasingly knowledge intensive, the skills that we acquire through human capital are really critical. But whatever definition of human capital we take, I think one thing is absolutely clear, that education is an absolutely critical component of human capital formation, and that children who are hungry and either out of school or sitting in classrooms, unable to learn because of the hunger they're experiencing, because of the micronutrient deficiencies that are holding back their cognitive development, and not able to develop the capital, the human capital that they need and their countries need. And I think this is such a critical point for the sub-Saharan African region in particular. At least 1/5 of Africa's children are going hungry, that is to say, experiencing real hunger. Well over 40% are living in homes that are struggling with food security, homes where the parents don't know where the next meal is coming from. So that's the underlying problem. And if hunger among school children is the underlying problem, I want to submit to you, before I get into the detail of what we're doing in the Sustainable Finance Initiative, that if that's the problem, part of the solution has to be getting food to those school-age children in their school canteens, in their classrooms, and in their playgrounds. And ultimately, that's what this initiative is about. And we can do it in ways that I think that support and boost local agriculture as well. So Sapna, if you could go to the first slide. Let me say just a few words about what the Sustainable Finance Initiative is. As you've already mentioned, it emerged out of the Education Commission as part of a collaboration with the School Meals Coalition that was created actually during the World Food Summit. Now, that was just a couple of years back, but since it was created, we now have 77 governments across the world that have endorsed and are supporting and driving the School Meals Coalition. And we have 80 stakeholder partners. This is UN agencies, multilateral institutions, non-government organizations, and research institutions as well. We have a very specific focus in the Sustainable Finance Initiative part of the coalition on the financing of school meal programs in low-income countries and lower middle-income countries. These are the countries where the potential benefits of school feeding are greatest, because as I've already said, this is where the problems of hunger and undernutrition are most concentrated. But it's also in these countries where the coverage rates are lowest and the financial resources available are most limited. To give you a couple of examples, in Latin America, a largely middle-income country region, coverage rates for school meals are around 90%. That is to say 90% of all children in public schools are getting access to school meals. Across much of sub-Saharan Africa, it's less than 30%. Now, you know, sub-Saharan Africa is precisely one of the regions in the world where these school meal programs could generate very, very big gains for human capital development. If you look at the financing part of the equation, around $48 billion is spent globally funding school meals. Over 90% of that envelope is spent in upper middle income and high income countries. By contrast, less than 1 billion is spent in low income countries. So you get a sense there of the misalignment between, on the one side, human need, as in children who are going hungry, unable to learn, unable to realize their potential, and the allocation of resources. And that's a misalignment that we're working with others to try and correct. How do we do that? If you go to the next slide, Sapna. We do it in three ways. We do it through analytical work, and we published our first report on financing for school meals in the context of the post-COVID crisis earlier this year. It's available on our website. We work with governments and with others who are working to close the school meals deficit and extend the safety net that school meal programs provide. And we do it by what we call amplification, which is about communication, dissemination, advocacy for effective and equitable school meal programs. I want to come back to the underlying problems that we're trying to address and which you raised Patrick, in your introduction, and which Babatunde just spoke about. So if you could go to the next slide, Sapna. School meal programs, of course, this is an intervention that happens in the classroom, but it has a wider set of implications for broader development goals and the sustainable development goals. There's proven evidence that effective school meal programs are very good at getting children into school. They're very effective in supporting learning in school. So, you don't just want children in classrooms, you want children in classrooms who are not distracted from learning by hunger. This is a problem that school meal programs, are well designed and tailored to address. They're also very good at strengthening equity in learning. There's evidence from Ghana, for example, a very large-scale school feeding program, which has raised overall levels of school attendance, has raised average levels of learning, but has raised levels of learning among the poorest children and among girls more than the average. So, we talk a lot about leaving nobody behind in the SDGs. This is a demonstrated example of leaving nobody behind in practice. School feeding programs are also a mechanism for addressing wider failures in the food system, the systemic food insecurity that I mentioned earlier, a way of supporting local agriculture through homegrown school feeding programs and other areas as well. Next slide, please. So let me just show you two slides, which I think capture why this is so important. This is a chart. You don't need to look at all the regions, but if you just look at the sub-Saharan African region, it basically shows you the incidence of extreme poverty, that is to say $2.15 threshold poverty among children, and the share of children in the population. And this is children under the age of 18. And it basically shows you in Africa, as is the case across the world, because of demography, because poorer families tend to have more children, children are bearing the brunt of extreme poverty. And if you go to the next slide, please, and extreme food insecurity. I would just invite you to take a quick look at this. And I know there's 4 columns and it's difficult to digest PowerPoints, especially when one of the labels is wrong. So for the figures for sub-Saharan Africa, the second column to the right is for 2021. Now, this shows 2 things. It shows the increase in undernutrition among children between 2019 and 2021. This is the critical period of the COVID disruptions that Babatunde was talking about. But I think, so we now have about 90 million children who are undernourished in the region. But what this graph also does, it takes FAO data and applies the national incidence of undernutrition to age cohorts. And so we've broken it down for the age groups 5 to 10 years old, 11 to 14-year-old, 15 to 17-year-olds. And we've done that for a very specific reason. First, because it captures just how many school-age children are affected by the undernutrition problem. Of course, not all of these children are in school. Many of them are out of school, partly because of undernutrition. But the second reason I wanted to show you this is because when we talk about child nutrition, we often focus on the under 5 group. And of course, that's absolutely critical, the first 1,000 days. But as Don Bundy, who is a professor at the London School of Hygiene and Tropical Medicine has pointed out, it's not just the first 1,000 days that count, it's the first 8,000 days. These critical growth periods during the primary school years and the adolescent years, when nutrition is absolutely critical to the healthy development of children and to their learning. So I just want to register with this graph that the problem of undernutrition in Africa and many other regions is very heavily concentrated among school-age children. Next slide, please. One of the first study that we did for the Sustainable Finance Initiative was to look in some detail at the financing of school meal programs across a small group of countries. And I've mentioned the countries in this slide. They included Tanzania, Senegal, Rwanda, Benin in Africa, Bangladesh, Bolivia, and Guatemala. And we wanted to look at, what are some of the common issues and challenges that different countries are facing. And of course, one of the big issues, and this goes almost without saying, is that the fiscal space available to governments to finance these programs was already shrinking in the aftermath of COVID. It has been shrinking even more dramatically with the re-emergence of a debt crisis, in particular in Africa. With many governments, Ghana included, now spending over a quarter of government revenue on debt servicing. This is crowding out public investment in areas like the school meals programs. There are efficiency concerns across all of the programs. The share of the school meal budget that is accounted for by administration varies a lot across countries. Some countries, Rwanda is a very good example, appear to be able to deliver more food with less per capita financing. And so there are a range of efficiency issues that need to be looked at. There are big questions about equity. If you're starting from a baseline coverage of just 20%, where do you put your next school meal? You don't want the school meal investments going to wealthier groups, but it's often very difficult to target the poorest children, the poorest areas. Different countries use different approaches. Kenya has been doing it by targeting arid and semi-arid areas. South Africa by targeting schools in the lowest income areas. But targeting is often very difficult in the governance environments that we're talking about. One of the big themes that emerge from the studies is that many countries, in fact, most countries, have quite ambitious strategic goals when you read the school meal strategy. But those goals are not integrated into budget planning or medium-term financial planning. There are very different approaches to revenue mobilization, which I'll come back to in a second. And a final point, which again I'll come back to shortly, is that aid financing for school meals is very, very limited. It's, I think, somewhere in the order of 0.03 of the overall international aid effort. That's way too low. Next slide, please. Now, let me say something first of all about the importance of these programs for poverty and food insecurity, and think back to those graphs that I showed you a little bit earlier. The average per capita cost of a school meal program in a low-income country or a low-middle-income country, if you average it out over a full year, is around $44. We're talking about daily transfers in the order of 20 to 30 cents a day, depending on the country. Now that sounds like a very small transfer, but for a family living below the poverty line, the poverty threshold, who might have 2 or 3 children into school, this can represent a very significant share of their consumption budget. So in the case of Benin, for example, it represents around 14% of the average consumption budget of a family below the poverty threshold. In Senegal, 10%. So you can see that these transfers for a family that is struggling with food security issues, having a child who is covered by a school feeding program can represent a very significant source of consumption support, but also a risk insurance during very hard times, for example, pre-harvest. Next slide, please. The overall funding of this program, and I'm sorry, there's a lot of data in this graph, but if you just look at the last two sets of columns, one of the most important things to say about school meal programs is they're overwhelmingly funded by national budgets. This is not donor-driven territory. This is governments doing it for their own citizens. Now, in lower middle-income countries, over 90% of school meal budgets come directly from domestic resources through the national budget. In low-income countries, the share is lower, obviously. It's around 45%, but it's also been growing during what are very difficult fiscal times. And I think that tells you something important about the national leadership and the national commitment to school feeding programs. Next slide, please. How are different countries funding their programs? And I think this is instructive because it's what came out of the research. You know, obviously there are very many different approaches, but what came out of the research was some examples which may be applicable in countries that haven't applied approaches that have been adopted elsewhere. Now, the general rule is that school meal programs, this is particularly the case for Africa, by the way, but in South Asia as well, overwhelmingly funded from general revenue. That is to say, the money is coming out of tax systems, the broader tax system. So that's the general rule, but it's not the universal rule. In Bolivia, the entire school feeding program, which applies not just to primary school children, but to secondary school children in public schools as well. The entire program is funded by a tax on hydrocarbon production and export. In Guatemala, the program is funded entirely by earmarked VAT budget lines. In India, the program is part funded by a special tax, which is assessed on the average income tax. So this is all to say that earmarked taxes, quite often public finance experts don't like earmarked taxes, but there is something to be said. I think if you potentially have a windfall from oil or gas exports, or from the exports of a surge in world prices for minerals like cobalt or copper, these windfalls can be invested in school meal programs. Another way that you can fund the programs is by taxing public bads, i.e. the sugar content of fizzy drinks and sugar intensive or ultra processed food. You can do it through windfall taxation, as I've already mentioned. Some countries, like Benin is an example, have used SDG bonds. So these are market bonds, but bonds that are specifically earmarked for dedicated lines of government expenditure. Impact investment is another area that I'm not going to go into, but there are opportunities there as well. There are other ways you can think about funding school meal programs. One of them is through budget reallocation. You can shift budget resources from one sector to another. You can shift resources from general subsidies to targeted subsidies, and this is a very effective way of targeting subsidies. And of course, you can reduce the cost of delivery. Next slide, please. Now, I said I would come back to the aid issue, and again, I apologize for having a lot of information in this graph. You don't need to focus on the specific countries or even the specific numbers, but there are 2 points I want to make with this graph. The first is the length of the column gives you a sense of the overall aid effort. So around $200 million was dedicated through aid to school meal programs in 2020, which was the last available year we had when we did that graph. It's now gone up to about $214 million. As I've already said, that that's a very, very small amount. What makes it even worse is that almost all of that aid comes from one source, which is the United States, the US US Department of Agriculture program. And most of the aid that comes through that program is US agricultural surpluses rather than homegrown foods in Africa and other low income and low middle income countries. So, I mean, Patrick, maybe we can come back to this in discussion, but the general problem that this is communicating is there's not enough aid. It would take around 1.7 billion in aid support to national efforts to get another 73 million children covered by school feeding programs. We're an awful long way from that goal. So when you ask the question right at the beginning, does the money always follow a good cause? Not in this particular case, no, it doesn't. Next graph, please. Next slide. Again, this shows you where the aid goes. And really the only point I want to make with this particular graph is you can see the biggest recipient of aid is Guatemala, which is an upper middle income country. Frankly, it's a country which could be doing an awful lot more to fund its own school meal program. You've then got many other programs where governments have put in place ambitious plans to scale up. Benin, Senegal, Rwanda, you can see them in that right-hand side of the box as you look at it, that are clearly not getting sufficient aid to support the national ambition. So it's not just a question of providing more aid, it's a question of pooling aid resources to a better strategic purpose and a more effective strategic allocation. Next slide. So these are the points I've just made. And also I would just add that the World Bank is not doing as much as it could be doing through its IDA budget to support human capital investments in this area. Next slide, please. So in the Sustainable Finance Initiative, we've set out a 3-year plan in the areas that I've mentioned. We're now working with a small group of countries looking at different options for scaling up programs. But the more that we've worked on this, and Patrick, this is the point I really wanted to leave you with, is it's very evident, I think, as the world focuses more and more on food system problems, that this is part of the solution. Now, what do I mean by food systems problems? Our global food systems generate about 1/3 of greenhouse gas emissions. Our global food system is leaving millions of people hungry, many of them children. It's leaving rural communities in poverty and highly vulnerable. And we have climate change effects intensifying. Now, done in the right way, school feeding programs can address all of these problems. You see many examples in Africa that could be scaled up, where school meals procurement is used to support smallholder farming. More could be done, but we know that it works. You can use school meal programs to wean children away from junk food and to encourage healthy diets. You can use school feeding programs to encourage regenerative agriculture and build those links between schools and local communities. So there's an enormous potential here. It's not fully realized, but we're really excited about working with others over the next few years to realize the potential. Thank you very much.
Thank you very much, Dr. Watkins. This was really a very enlightening presentation. I want to make sure that everybody can hear me. I think there were some, yeah? Okay. So,
school meals transfers as a significant source of food consumption. This is quite remarkable findings, because as you said, we did mention the poly crisis, and we know that children are disproportionately affected by poverty, but also food insecurity, as you were presenting, is rising really and fast among children. So the school meals represent really a unique opportunity to support education, to support health and nutrition outcome when it's well targeted. But for that, we need definitely money. Thank you very much for showing the different possibilities that were there on expanding the fiscal space, particularly on supporting government, as you rightly put it. Most of the school meals programs are overwhelmingly supported by government, by national government. And it can be seen as a burden when we don't have the right strategy, when we don't put also together a more holistic, comprehensive case that is based by solid, robust research. And I really like the approach of analyzing, acting, and amplifying. And it's key that to highlight that research is still needed in most of to make a stronger case, of course, and support the development, co-development, as you call it, of financial strategies and advocacy. That's what SERFAM is also trying to do here. So thank you very much for also highlighting that there's not enough aid for that, and the very limited aid that exists may not be sustainable, since it's coming from very limited donors and also based on food surpluses and not necessarily boosting local production, offering opportunities. Thank you very much, Dr. Watkins. And stay with us, as there will be more questions coming from the public. And I really want to take a bit of time to thank all those who are joining us. We're over 114 participants right now online from various parts of Africa and beyond. And I would like also to remind all the participants of the possibility of interpretation in English, French, and Portuguese. Just reach out to your preferred language so you can follow this. So what struck me during the presentation of Dr. Watkins, he did show that amongst the countries receiving most aid, I saw Mozambique. Mozambique was there as over 40% of the aid that was being received. And this is exactly what we're gonna do the transition now to speak to Dr. Arlinda, who is the National Director of Nutrition and School Health at the Ministry of Education and Human Development in Mozambique. And now with your authorization, I will switch into Portuguese so I can welcome Dr. Arlinda Chakis, who will be doing her presentation in Portuguese. So thank you very much for those who have time to switch to the Portuguese interpretation. So tenho muito prazer agora em acolher a nossa segunda panelista, a doutora Arlinda Chakis, que atualmente atua como Diretora Nacional de Nutrição e Saúde Escolar no Ministério da Educação e Desenvolvimento Humano em Moçambique. Ela tem essa função desde 2015 e coordena o Programa Nacional de Alimentação Escolar. Agora, a biografia da doutora Arlinda, ela estudou a medicina na Faculdade de Medicina da Universidade Eduardo Mondlane e fez um mestrado em Medicina Tropical e Saúde Internacional. Exerceu a profissão de médica durante 22 anos e foi destacada para o Hospital Central da província de Nampula, onde trabalhou nos departamentos de Medicina Interna, Pediatria e Ginecologia e Obstétrica. Antes da sua nomeação como diretora nacional, foi formadora de cuidados obstétricos essenciais na província de Nampula e prestou também cuidados a doentes com HIV no Hospital do Dia. Simultaneamente, foi responsável pelo Departamento de Formação Inicial e Contínua de Profissionais da Saúde, de nível médio, e diretora do Instituto de Ciência da Saúde durante 10 anos. As atribuições anteriores dentro da direção incluem servir de ponto focal para a resposta à Covid-19 no setor da educação durante a pandemia, e a doutora Erlinda é casada e mãe de 2 filhos. Temos muito prazer em acolhê-la. Agora, a doutora Erlinda Chaquice vai compartilhar conosco a inovadora iniciativa de troca de dívida de Moçambique com a Federação Russa para apoiar o fornecimento da refeição escolar. Doutora Erlinda, seja bem-vinda, a palavra é sua.
Bom, muito obrigada a todos. Não sei se consigo me fazer ouvir.
Estamos a ouvir, mas o som do meu lado não está muito alto. Se puder, talvez, aproximar do microfone ou falar um pouquinho mais alto. Obrigado, doutor.
Tá certo, tá certo. Dizia muito boa tarde a todos. Em Moçambique já passam das 12 horas. E, antes de mais, gostaria de agradecer a oportunidade de poder participar neste webinar e podermos falar um pouco sobre o nosso programa de alimentação escolar no contexto do financiamento da dívida que o país tem com a Rússia. Eu pedi aos organizadores para poderem partilhar a apresentação através da sede e peço que se possa partilhar para poder iniciar a minha apresentação. Obrigada. Sim, conforme dizia, eu vou falar um bocado do caso, um estudo de caso de Moçambique em relação ao acordo da conversão da dívida russa. Próximo diapositivo, por favor. Bom, a minha apresentação vai ser baseada em 6 pontos, em que vamos falar do marco cronológico da própria alimentação escolar e também o programa aprovado e a sua expansão. E depois vamos falar um bocado das características do acordo da conversão da dívida russa, as oportunidades e as lições aprendidas. Próximo slide, por favor. Em termos de marco histórico, o país ficou independente em 1975. Nessa altura, havia necessidade de promover o ensino a todos os moçambicanos como um direito. E em 1978 foi criado o Programa de Alimentação Escolar, que era essencialmente para permitir que aquelas crianças que precisam que as crianças pudessem estudar e que para tal tivessem as condições básicas. Nesta altura, nós fazíamos a oferta de alimentação escolar ao ensino pós-primário e com maior foco nos centros internatos. O processo foi evoluindo de diferentes formas, mas com o foco principal a nível da oferta da refeição a nível dos centros internatos, com maior privilégio para as próprias raparigas. E em 2010 nós tivemos a oportunidade de poder firmar um acordo tripartido com o apoio do PMA em Moçambique e o governo brasileiro de cooperação, que este acordo permitiu a formulação da implementação do próprio programa. E em 2013 tivemos a aprovação a nível do Conselho de Ministros do país, que é um órgão que é dirigido pelo Presidente da República, e nesta política nós tínhamos como objetivo reduzir o impacto que a desnutrição e a fome pode causar a nível do setor da educação. De 2013 a 2015, nós iniciamos a implementação através do piloto, e nesta altura nós trabalhávamos em poucas escolas e tentávamos implementar 2 modelos de alimentação escolar. Um em que era centrado na própria escola primária e o outro que era centrado nos serviços distritais. Os serviços distritais são instituições que fazem a gestão das escolas numa determinada área geográfica. E em 2017, de 2017 a 2022, nós, com base nos resultados do programa piloto, tivemos a oportunidade de fazer a extensão do próprio programa. E no período de 2015 até 2017, nós iniciamos com os passos necessários para podermos expandir o nosso programa através da conversão da dívida russa. Passo a seguir, por favor. O slide a seguir, por favor. Próximo slide, por favor. Bom, o que na verdade se cinge o nosso programa de alimentação escolar? Conforme eu dizia, que é mesmo para reduzir de forma sustentável o impacto que a fome e a insegurança alimentar causam no nosso setor da educação. Com fome, as crianças abandonam a escola ou não vão sempre e, por via disso, acabam não conseguindo ter um aproveitamento positivo. E este programa nós estamos a implementar olhando para 3 pilares principais, em que um é efetivamente a própria alimentação escolar, aqui com o objetivo de melhorar o estado nutricional e a saúde dos próprios alunos. Temos um segundo pilar, que é da educação alimentar e nutricional, porque é importante explicar às crianças e a toda a comunidade a importância das pessoas se alimentarem bem, olhando a diversificação que existe também a nível das nossas comunidades. E o terceiro pilar, que é do desenvolvimento das competências para a produção agrícola e pecuária, tendo em conta que o nosso programa ele preconiza a aquisição e compra de produtos locais, principalmente para o pequeno agricultor. E aqui também nós temos algumas atividades complementares. Essas atividades complementares nós olhamos para a melhoria das infraestruturas a nível das escolas, o sistema de monitoria e avaliação, que também é importante para nós podermos ver quais são os ganhos e podermos medir, podemos melhor avaliar como é que poderemos caminhar melhor. E também temos feito a monitoria sistemática dos preços, porque temos que trabalhar com diferentes comunidades. Sabemos todos nós que a alimentação escolar não é barata, mas para isso é importante que nós possamos evitar a discrepância dos preços para podermos garantir a implementação nas nossas escolas. Próprio diapositivo, por favor. Bom, desde a altura que nós iniciamos a expansão do nosso programa, em 2017 e 2018, através da conversão da dívida russa, nós fomos evoluindo de uma situação de 70 escolas que nós tínhamos na altura, e no ano seguinte passamos para 150, e depois tivemos algum constrangimento, e em 2020 ficamos com menos 2 escolas, mas de 2021 até a este momento nós estamos a implementar o programa em 340 escolas com base na conversão da dívida russa. E estas 340 escolas estão em todas as províncias do país. O país tem 11 províncias, mas e não estamos em todos os distritos, estamos apenas em 42 distritos a nível do país. Próximo diapositivo, por favor. Bom, quais são as próprias características deste acordo? Tudo começou com a assinatura de minutas entre os ministros das finanças dos 2 países, aqui refiro-me a Moçambique e a Federação Russa. Em 2015 foi assinado esta minuta. Tivemos um período de negociação de cerca de 2 anos, que era para podermos ver como é que deveríamos implementar este programa, tendo em conta que esta conversão ela vem para projetos de desenvolvimento social, e neste caso a educação usou esta base para poder ter acesso a este recurso. Por via disso, firmamos firmamos um acordo com uma base de 40 milhões de dólares para 5 anos, com uma disponibilidade de 8 milhões de dólares ano para podermos implementar, não apenas na oferta de alimentação escolar, conforme eu disse, mas também o reforço das nossas infraestruturas. Aqui falamos das cozinhas, da abertura de furos de água e da construção dos próprios armazéns, bem como a aquisição de utensílios para poder implementar o próprio programa. E para podermos ter este acordo, tivemos que ter alguma mediação por parte do Programa Mundial da Alimentação em Moçambique, em que foi necessário firmar-se um acordo entre o Programa Mundial de Alimentação e o Ministério da Economia e Finanças, e a fotografia à minha direita mostra esse momento da assinatura e de troca de pastas, e depois tivemos que assinar um outro memorando de operacionalização entre o Programa Mundial de Alimentação e o próprio Ministério da Educação e Desenvolvimento Humano. E por via disso, recursos saem do Tesouro do Banco Central de Moçambique, passam para o Programa Mundial da Alimentação e depois é que são repassados para o Ministério para poder fazer a gestão deste mesmo programa. E aqui é importante realçar que anualmente temos um plano operacional que ele é feito de acordo com entre o Ministério da Educação e o Programa Mundial da Alimentação, e inicialmente nós tivemos que fazer a transição gradual daquilo que eram as responsabilidades de cada uma das partes. E depois de todo o processo de implementação, temos que prestar contas ao Programa Mundial da Alimentação e este, por sua vez, interage com o Ministério da Economia e Finanças. O próximo slide, por favor. Com base nesta oportunidade que tivemos em trabalhar com este fundo da conversão da dívida russa, foi possível nós expandirmos em grande aquilo que é o nosso programa, permitindo que muitas crianças, cerca de 200 mil crianças, pudessem se beneficiar da alimentação escolar nas nossas escolas públicas. E por isso e por via disso também nós estamos a criar uma uniformização em termos de abordagem escolar no país, porque apesar de nós estarmos a implementar o programa, temos acordos com alguns parceiros nacionais e internacionais que também implementam o programa em algumas escolas. Então era importante que uniformizássemos e que todos pudéssemos garantir a diversificação da dieta e privilegiar os produtos locais para se poder fazer a confecção do lanche, porque por via disso temos que olhar nos ganhos da própria comunidade, porque é importante olhar para o pequeno agricultor, o pequeno comerciante, de maneira a ele poder melhorar a sua renda. E também uma outra oportunidade que tivemos com a conversão da dívida foi termos este apoio financeiro plurianual que nos garante anualmente e continuar a implementar o nosso programa. E até este ano nós estamos a negociar de maneira a ver se conseguimos uma expansão da implementação da dívida russa, tendo em conta que o acordo inicial tinha 5 anos de vigência e venceu em 2022. Só que com a situação da Covid e os desastres naturais que aconteceram no país, tivemos a interrupção do lanche na altura em que as escolas ficaram encerradas por mais de 6 meses e por conta disso tivemos alguma reserva deste orçamento que estamos a usar agora, mas é a altura de voltarmos a negociar para podermos ter a expansão deste financiamento. E também com base nesta oportunidade da conversão, nós estamos a trabalhar em alguns instrumentos normativos, estamos a trabalhar na estratégia, precisamos de garantir uma legislação para ver se temos a sustentabilidade e expandirmos mais a alimentação escolar que nós pretendemos ter no nosso país. Próximo slide, por favor. Bom, este slide, na verdade, só nos dá as lições aprendidas através do acordo, em que nós voltamos a melhorar dia após dia aquilo que são os nossos sistemas de financiamento e que são adequados quer para o governo, quer para o próprio Programa Mundial da Alimentação. Estamos a melhorar aqui o nosso sistema de monitoria e gerenciamento de dados, tendo em conta que este programa ele acontece efetivamente na escola e no distrito, mas há uma necessidade de nós podermos apoiar o distrito, quer à distância ou quer presencialmente, mas também termos o reporte para podermos avaliar e medir e ver que caminhos poderemos seguir para cada vez mais melhorarmos o nosso programa. E também é importante darmos aqui a lição da gestão de transferência de fundos, que deve ser adequada tendo em conta as grandes complexidades que o país apresenta, mas há uma necessidade de fazer a transferência e a prestação de contas. E também, neste momento, nós estamos a finalizar uma avaliação intermédia do programa, com base em padrões internacionais, e esperamos ter algumas ou muitas recomendações que nos possam ajudar a melhorar cada vez mais o nosso programa. Aqui nós também falamos um bocado tivemos a oportunidade de aprender em relação à clareza das funções e responsabilidades de cada um dos intervenientes. Cada um sabe ao seu nível o que é que deve fazer, como é que deve fazer, para que no final todos nós possamos garantir que as crianças permaneçam na escola e tenham o rendimento positivo que todos nós almejamos. Bom, eram essas as informações que gostaríamos de partilhar neste webinar, e acredito que este é meu último slide. O próximo, por favor.
Muito obrigado, doutora Arlinda.
Aqui eu só queria mostrar uma imagem de uma das nossas variedades do nosso menu, em que ele é efetivamente feito com base nos produtos locais, e temos a oportunidade de trabalhar com base nesta conversão da dívida russa. Muito obrigada.
Muito obrigado, doutora Arlinda, pela brilhante apresentação que mostra que o PRONAE é realmente um programa de sucesso em Moçambique. Passou de 70 a 340 escolas em 4 anos, em termos também de beneficiários alcançados. Isso mostra a importância do programa. Agora, tenho uma pergunta para a doutora Arlinda, é que o doutor Watkins falou de dependência, ajuda externa para com financiamento das refeições escolares. Então, não sei qual seria a estratégia a médio e longo prazo, sabendo que essa inovação da conversão da dívida russa, que é uma oportunidade de salientar a boa prática, mas qual seria, digamos, de uma forma mais sustentável a estratégia do governo em relação com um financiamento já mais regular deste programa, deste importante programa?
Bom, naquilo que tem sido a nossa discussão a vários níveis, não restam dúvidas que termos que sempre depender de donativos, de doações ou de financiamentos externos, isto poderá não nos dar a segurança e a garantia de uma implementação contínua do próprio programa. Nós temos nos espelhado muito desde o início com o Brasil, e por via disso achamos que é importante nós trabalharmos muito na legislação. E trabalhando na legislação também, paralelamente, nós temos que trabalhar com a entidade governamental que lida com a questão financeira, que falamos do Ministério das Finanças. Porque se nós tivermos uma linha orçamental nas nossas instituições que garantem a implementação do programa de alimentação escolar, poderemos permitir que este programa seja contínuo e a pouco e pouco vamos reduzir esta que é a questão da dependência externa. Na apresentação passada falou-se da questão do uso, aliás, do aproveitamento dos recursos minerais que os países têm para, através das taxas, olhar-se para esta componente da alimentação escolar. Esta tem sido também uma das discussões que temos trazido, mas assumimos nós que a questão da definição de uma linha orçamental, a questão de uma lei, se nós temos uma lei, esta lei, ela vira-se uma obrigatoriedade do próprio Estado. Aí não teremos que fazer as dependências de cada 5 anos que duram os governos no país para termos a certeza de que teremos ou não teremos a alimentação escolar. Mas se ela estiver na lei, aí facilmente nós poderemos exigir ou permitir que o caminho esteja aberto para podermos implementar o nosso programa. Muito obrigada.
Muito obrigado, doutora Clarice. Fica conosco, porque vamos ter mais perguntas no chat box. Daqui a um momento, aproveito também para felicitar os meus parabéns e vou também para o Programa Alimentar Mundial em Moçambique, toda a equipa que permitiu essa conexão com o Ministério. Muito obrigado. Agora vou passar do português ao inglês de novo. Isso é o benefício, a riqueza deste tipo de seminário, onde temos várias pessoas vindo de várias partes, e é sempre bom poder também falar a língua em que o intervenente fica mais à vontade. With your authorization, now I'm going to switch to English, since the next panelist will deliver a presentation in English, his presentation in English. So I'm really pleased to welcome Dr. Amar Abdul Ahmed, that currently serves as the manager for education, health, and nutrition from the Islamic Development Bank. Another bank, so money is the essence, financing. Mr. Amar Abdul Ahmed duties includes ISDB health policies and strategies, designing and appraising cross-regional health programs, and providing expertise in alternative health financing, partnership for health, disease control and prevention, maternal, newborn, and child health to ISDB regional hubs and members countries. He is Gavi and Global Financing Facility for focal point for ISDB. Mr. Amar Abdul Ahmed, areas of expertise include training, research, and development for health. As a senior health specialist between 2014 and mid-2018, he has also managed a health portfolio amounting to US $300 million as project team leader for health in Cameroon, Niger, Sudan, Tunisia, and the Western African Health Organization. So thank you very much, Dr. Amar Abdul Ahmed, for joining us. The floor is yours.
So thank you, Patrick. Thank you very much, Patrick, for the introduction. And thank you. I would like to thank you also for organizing this event, you and your team. You have made, I think, a great work by bringing all of us together. And it's a real pleasure for having me today. And I would like to thank first my colleague, Dr. Babatunde, a friend of mine from the African Development Bank. Very happy to see you today. And others, representative, mainly Kevin also, is a pleasure, one of our key partners in school feeding programs. And I believe that we have many others among the guests and the people who are listening today. So let me start by just bringing an overview of the Islamic Development Bank. Maybe many of you might not know the Islamic Development Bank. It's actually a multilateral development bank like the African Development Bank. we have 57 member countries, of which we are sharing with the African Development Bank 22 common member countries. And our member countries, so we are scattered across 4 continents, because we have in countries in Asia, in Europe, and in Latin America. So we have a big actually responsibilities, as we are working under different in different regions, but also different economic settings. So we have high income countries as we have low income countries. We have to deal with obesity as well as you have to deal with the stunting. So this is making our job not easy, as you may imagine. So education remains one of the key pillars of the bank. Investment. So we have invested over $5 billion in the education sectors. And we have also invested in the health sector and in nutrition. But our main focus before was not directly in the nutrition because we are not a humanitarian organization, okay? So this is why we were supporting mainly the agriculture part. We were supporting food security and agriculture in our common member countries, in our 57 member countries. And in 2018, we had new policies in health and education where we are working under the theme of affordable quality health services for human development in the health field and learning for human development in the education field. So if you see in our 2 mottos, we have human development linked to education and linked to health. So why it's very interesting. I would just here compliment my colleague Dr. Babatunde, who has spoken enough about COVID-19 investment that we have made jointly to support our African member countries. So the COVID-19, just by saying maybe that the COVID-19 crisis has rolled back years of progress in nutrition. So this is a fact today. For instance, if we look at the stunting, we have increased by 1.2 million stunting cases in Africa only, in sub-Saharan Africa only. For wasting, for instance, we have increased it by 1.9 million. And also in terms of maternal anemia, if we look into it, it has been increased by 0.6 million. So what does it mean? Does it mean that many efforts that we have made in terms of investment in the field of nutrition, in the field of maternal, newborn, and child health have been rolled back by COVID-19? So this is making, I think, an imperative today to all multilateral development banks to invest in human capital development and mainly in nutrition. Now, just in summary, I will give you why we have to invest in human capital development. It's easily, when we look at the human development capital, we are talking about the productivity of a future worker tomorrow. So we need, and if we want to have a productivity, a real productivity in terms of contribution to the GDP of the country, we need to look after 3 criteria that all of us know. First, the survival. If this child is not surviving to grow up and to become a future worker, so it's not. How could you, if you are not securing its survival up to the adult age, so he want to be able to contribute to the economy. The second is the schooling, and in terms of schooling, we are looking after the quality years of school, because this will improve also the productivity of the future worker. And finally, to the health. Someone who is not in good health is not ready to produce, so he will accuse many acknowledge many absence and many conditions that will prevent him to be a real productivity. So that's why in the Islamic Development Bank, our ultimate goal is to promote human development through investing in these priorities areas: education, health, nutrition, poverty reduction, and governance. And today we have understood that with millions of children going to school hungry, effort of improving these learning outcomes are seriously treated, so or thwarted. So several, actually, the good things also, because we are an organization led by its member countries, we have received also many financial requests from our member countries to finance the school mealing program and to support national school feeding program. So now, what are the support to the government? What can we do actually to improve better to help our member countries to mitigate the challenges posed in the field? So I will be very synthetic here by saying that we need more financing resources for nutrition, as well as we need more nutrition for each dollar that we will spend. So some of you might ask me, so why? The first one is very easy part, because many dollars, so we could mobilize the money, is not what's missing today. Even if we cannot, we are reaching out to our colleagues at the African Development Bank and the Asian Development Bank or the World Bank, and we are coming together to jointly finance any project. So, however, it could come also but what we are looking for today is more ownership from the country. So mobilizing more domestic resources for nutrition. This is a critical part. The second also, we are looking after innovative financing, and innovative financing is very important today because many of our member countries, our African member countries mainly, because they are either a low-income countries or a lower middle-income countries, they cannot get access to a financing because of their headroom, what we call it in our jargon. So the headroom is what? So they have a debt ceiling that is preventing us to go beyond the threshold. The third aspect also, what's needed is also we are needing more grant resources to support the nutrition field, and I will explain to you why later on. The grant resources are critical because there are some countries that cannot borrow. If on the continent, if we look into it, like Somalia, for instance, they need some more grant resources. So this is pushing us to increase our grant resources and also to call merely donors and to call philanthropists to invest in the nutrition field. But we know the very important thing is that those donors and those philanthropists that are coming along to the country is like a drop in the desert, because they need to leverage more resources to make this investment worth it. And now the second aspect in terms of nutrition financing is we need more nutrition to each dollar spent. What does it mean? Does it mean we need a bankable proposals coming from the member countries? And this is missing in much of our proposals that we are receiving. We need evidence-based planning. We need costed plans. We need also financial assessments, and we need program evaluations before going to a second phase or a third phase. We need to assess what has been done so far. And the bottom line for all this is to have a very strong data system that will prevent us to fly blinded. So this is our suggestion. I will move actually in our human capital development initiative. Why the bank is investing in learners' futures. We are investing in learner futures because all of us today around in this August room and meeting, and all the participants has understood the intrinsic a link between the nutrition and the human capital development and the economic growth. Because why? Why investing in the early nutrition, as I have presented at the beginning of my presentation, can increase. Requires will help in increasing the schooling. Because it will increase the number of years completed by the child at school. So this is very important. And second thing, it will increase also its earning in the futures, because as we have presented, it will improve the quality. The quality of education will make him having access to better jobs, to better employment. And as per some of the studies, and this increase in terms of wages is between 5 and 10 and 50%, between 5 and 50%. Could you imagine? So, and the third point is that also it will reduce poverty, because the non-stunted children are 33% more likely to escape poverty as adults. And it will improve the economic growth. So it will contribute to the economic growth. The reduction in stunting actually can increase the GDP of a country between 4 and 11% in Africa. So if there is no action to be taken, so what will the cost of undernutrition? It's about 3 trillion per year. The same thing in our member countries. We have obesity also and overweight. In our high-income countries, our richest countries like the Gulf countries, the GCC countries, but also today we are seeing the obesity and overweight. It's responsible lost between $1 and $2 trillion per year. So actually, this is why it's very important to invest, and so and this is why we reach out to WFP. For instance, we created an innovative financing tool actually in terms of I think you may heard about it, the 1,000 day initiatives, and also to support the national school feeding program, and this will help us to actually converse on investing more in children in terms of education by leaving no one behind, agriculture, zero hunger, health, improving their health status, and providing safety nets to our kids in our member countries. And so we have some options that are available here because of our also peculiarities, because we are using Islamic financing, and the Islamic financing is permitting us to use what is called the generosity of many of our richest, our wealthiest people in our member countries, to use what we call it the endowment, for instance. So the Waqf endowment for sustainable support to our member countries. But again, it's not enough. It's not enough. So I will share with you 2 case studies today. The first one is the pilot, one case study, sorry. So because the second I withdraw it. The Benin pilot project that we are currently supporting, that we will be supporting. So it's an initiative to support the transitioning middle and lower income countries to investing more in school feeding. And so this project, so for that, the countries, our member countries, must demonstrate commitment to a multi-sectoral approach to investing in the learner future. So we have countries that have expressed interest and have been identified for the first phase, Benin, along with Gambia and Senegal, that will participate in this program. However, it's not our only program, because we have existing programs that is supporting actually we are leveraging on those existing programs to support the kids in the schools, because this will be complementing the existing, because we are bringing foods to the school. And we have many programs that if you go to on our website, you could notice it. Finally, let me tell you that it's very important. It's very important. The investment in human capital, in nutrition, pay economic returns far into the future, actually. So, but because the benefits are distant, are not immediate, actually, because we are talking about the middle and the long run. So policymakers or politicians may not sufficiently prioritize such investments. But it's very important that even though the costs are very important here, today, but it will pay a lot in terms of economic growth, because we cannot, as we explained previously, the economic growth is measured over years. Thank you very much. I will stop here. Over to you, Patrick.
Thank you very much, Dr. Ahmed. That was another brilliant presentation where you clearly built on the previous panelists to insist on the importance to have a multi-sectoral approach, since investing in the development of human capital shouldn't be seen just from a narrow point of view of education, but it engages more sectors. And it was really important also to highlight the cost of inaction. Not doing anything will definitely cost more to the countries. The support that the ISDB is providing in response the polycrisis that Babatunde referred to was really important to say that institutions like yours are there also to support countries in building a stronger legislative framework, in investing in strengthening the capacity of national institutions to manage the program in a more effective and efficient way. So, Dr. Ahmed, I just have a question coming from now, because you mentioned the case of Benin, and I have online Ali Ouattara, who, if I'm not mistaken, is a WFP representative in Benin, who did mention that their proposal has been submitted a few months ago, and he would like to know whether this has good chances to be approved by the board. I don't want to put you on the spot, but because you mentioned Benin, and we do have the representative there, if you have a few information regarding that, and also on the outreach, how can globally people interested also reach out to Islamic Development Bank to continue the conversation, the very interesting conversation we've started today. Over to you, Dr. Ahmed.
So thank you very much. So it's a process. Actually, it's a process matter. So the project is submitted, and it's following its normal. We have a project life cycle, internal also committees, internal review that it's going through, and also a lot of preparation because, as I said at the beginning, so we need to have a bankable project because at the preparation stage, and also it has to be appraised, and there is a thorough, and we have to look after different aspects in terms of procurement, financial management, sustainability, and so on. So, but it's on good track, and our board actually are not meeting on daily basis, because we have a board meeting every 2 months, every month sometime, but because of the holidays also, we may have it in September. But it's on good track. Now coming to the second question related to how they could reach out to us. So actually, we have, as the African Development Bank, we have focal point at the Ministry of Finance or a planning. So the ministries of education could reach out to us through what we call it the ISDB governors. And the ISDB governors are either the Minister of Finance or the Minister of Planning, depending on the countries. So the Ministry of Education has to communicate their request. First of all, they could discuss with us technically on technical basis, and when it's ready, we can give them the go ahead. And then officially, because we are not dealing with directly with individuals or with the private sectors, unless the private sector also bring to us a sovereign guarantee. But if not, we are dealing directly with the Ministry of Education. They could discuss technically with us, then refer to the minister, our ISDB governor, who is the Minister of Finance or Economic Planning, to submit to the bank an official request, and this will trigger the official request triggers all the process. Great, and you have the address. You can go over on internet, just put ISDB, and you could identify who is the ISDB governor on our website. Depending
thank you very much for the answer, and for all the participants. The presentation will be shared, and all the resources, and you also have contact details there for those who are interested in continuing this conversation. I would like to acknowledge the presence of various partners that are online, and on the chat box, I was looking at one message sent by Anna Branford Archer from the Rome-based agencies, so FAO, IFAD, and WFP, who really is highlighting the importance of to support national homegrown school feeding program, and in leveraging South-South and triangular cooperation for that. And I'm really happy that this webinar is helping connecting with Mr. Watkins, so we can pursue that conversation. I'm checking now, is a time where we're gonna go to question and answer, so stay with us, and Dr. Ahmed with all the other panelists. There's a few questions before we wrap up, and one of the questions that comes in French is about by Mr. Haruna Kadri Haruna, who is saying, what are the strategies, programs, the specific strategies and programs targeting Sahel? And we know the situation in Sahel is quite recurrent. We have a lot of increasing majority of the population living in a rural area with extreme poverty. And if you add to that the security situation that led to closing many schools and a lot of displacement. So I don't know to whom that question can go, but I would be tempted to see whether Dr. Amilola has any elements of answer to that, or Dr. Watkins, if you have a few elements of answer to say, is there something specific we can do in that region that is really facing food insecurity, conflicts, displacement, and also climate consequences? Who wants to go first?
Patrick, I don't have specific information on the Sahel,
okay,
but the question is a super good one. And I know there are initiatives in the region. There are countries, that are trying to expand school feeding programs, Mali, Burkina, and others. So I'd be very happy to look at what initiatives might be out there and to communicate them separately. But I don't have the information to hand, I'm afraid.
Yeah. No, thank you very much, Dr. Watkins. I understand that this is clearly in the areas where school meals can really make a difference in terms of not only making sure that we're keeping children at school, but we're also building some kind of continuity. When there is a school, there is a sense that of normality there. And the social, it's an important element of social cohesion, and really making wherever you have those ethnic tensions, that you definitely have school meals as a way to keep the community together, and really making sure that all nutritional health indicators also are not aggravated. And as Dr. Watkins said, there's several initiatives. We're happy to connect you with those, including those from the WFP Regional Bureau in Dakar, and other initiatives from the school-based program unit in Rome. Another question that may seem...
Maybe just...
yes, you want to... Okay.
Exactly.
Dr.
I want
Ahmed,
to come in. I want to come into this because...
Yeah, please.
Actually,
please.
The bank, so following COVID-19, we had, as good as the African Development Bank, we have our SPRP, what we call it, our COVID-19 Strategic Response and Preparedness Plan, that we delivered on it during the past 2 years, so during the COVID-19 pandemic. So after that, it's ended last year in December 2022. And actually, we have a new program called Food Security Risk FSRP, so Food Security Preparedness and Response Plan, that is amounting for more than 4 billion. And it's targeting to support these areas. But as I said, we have disbursed as per the last figures. We are almost to disburse almost around 1 billion on it in cumulative approval or expected to be approved. So this could be this is one of the financing facility that the bank has put in place, given the situation so that this situation, this crisis, this food security crisis that we are facing in the world, and so how now to submit to apply for this support. It could, by the way, it is include, you could include, the countries could submit nutrition program in it. Nutrition projects, I mean by that, but as I said initially, so it has to go through the
process.
Through the process, yeah. Exactly. So this is one facilities that it's available, and we could give you more information about the facility, but as I told you, it needs to be through the official channels. Thank you.
Well, thank you, Dr. Ahmed. And SERFAM is really happy to help with the outreach and dissemination advocacy on that. There's another question that comes, and that one can go to Dr. Watkins. Is more generic, but also to Dr. Arlinda to have her perspectives. That is that comes from a dear friend, Dele Agbo, that I want to say hi to. So if donors and governments agree that school meals programs are the best social protection mechanisms, then why don't they commit to a blanket coverage of the schools on the continent as a way of building reliable human resources and help the continent emerge out of chronic poverty in several places?
You want me to kick off, Patrick?
Yes, if you have just a few thoughts you want to share on that, if everybody is recognizing that that's really a smart investment, and why they're not doing it?
Well, I think it is clearly a smart investment, and if you look around the world, look at some of the countries that have made extraordinary progress on reducing undernutrition among children, not just under 5s, but through the school years. Brazil, Bolivia, other countries in Latin America. these are countries which do have universal school feeding programs in place. And of course, every country has its own history. And I don't want to suggest that school feeding is a standalone strategy. Schools aren't open the whole year. Schools aren't open at weekends. Schools close during breaks. So they're not a standalone safety net. But I do think the evidence is so overwhelming that there are benefits for learning, there are benefits for school attendance, there are benefits across generations, which has just come out from a big evaluation in India, that the mothers of the children who attend school programs, school feeding programs, are less likely to be stunted than the children of mothers who didn't attend. So I think there's an overwhelming case for going for universal school feeding by 2030. It's clearly affordable. I think if governments look at the different revenue streams that might be available from more progressive and efficient tax systems, from using some of the revenues that will come from oil and gas, from transition minerals and so on, it is possible. I think what's been lacking, to be honest, Patrick, in my view on this, is that we're all a little bit compartmentalized, right? When in the way that we think about problems. So we think about a nutrition problem, that's for the Ministry of Health. We think about an education problem, that's for the Ministry of Education. Social protection is somewhere else. Agriculture is dealing with smallholder farmers. The finance ministry and the economy ministries are dealing with productivity. But actually, in the real world, there are no silos. We're discovering with climate change, there are no borders. With the pandemic, there were no borders. These silos have to go. And I think if we thought across the silos and asked ourselves, what's the one thing that we can do that connect these different aspects of the real lives of poor people? All of us are parents, right? Or for those of us who are parents, we have children. Do your children learn well when they're hungry? Ask yourself that question. And if the answer is no, which it clearly is, why do you think anybody else's children can go and sit in a classroom and learn? So I think every education minister in Africa should be saying, look, you want me to deliver results in education. I can't deliver results when half the children in these classes are going hungry. Like, stop thinking in boxes. So I think let's get out of our boxes. And I think aspiring to universal provision in 2030 is clearly the right thing to do.
No, thank you very much, for those wise proposal recommendations and thought that you've just shared with us. Doutora Arlinda, não sei se quer também responder a essa pergunta. Ainda está conosco, doutora Arlinda? Não sei se a doutora se está a me ouvir, e sobre essa pergunta que diz que se de facto a merenda escolar tem tanta oportunidade, é um programa de excelência, por que o governo não faz uma cobertura nacional, global, em todo o território? O que impede isso ficar uma prioridade para o governo? Não sei se estás conosco.
Sim.
Sim, ok. Obrigado.
Estou, mas estava com alguns cortes, por isso, por favor, eu peço aquilo que
não, posso repetir a pergunta. A pergunta é que se toda a gente está de acordo com o programa de alimentação escolar, é um programa de excelência que cobre, que traz várias oportunidades, por que o governo não expande a cobertura a todo o território nacional, dando prioridade ao programa de alimentação escolar como um meio para atingir o desenvolvimento do capital humano?
Bom, na verdade, é um bocado difícil de garantir a implementação em todas as escolas. Nós estamos a falar de um país que temos cerca de 13 mil escolas primárias, que é lá onde nós estamos a implementar o programa de alimentação escolar, mas não estamos a conseguir estar em todas as escolas, tendo em conta a complexidade que se prende em relação à questão financeira. Nós, com os recursos que temos através desta conversão da dívida, só conseguimos abarcar este número de escolas, e a nossa vontade, na verdade, seria fazer um bocadinho mais. Mas também, quando nós falamos de escolas com diferentes, desde escolas com construção convencional, escolas de construção precária, que até muitas delas nos ajudam na construção, e depois também estamos a falar de espaços com uma árvore e tudo, os alunos estão lá a estudar. Então, só queria trazer aqui os grandes desafios que o país ainda enfrenta, que acreditamos que ainda são diria, um bocadinho mais urgentes em termos de oferecer esta questão do lanche. Não porque o lanche não seja importante, não seja prioritário, mas ainda é importante criar as condições básicas para que o aluno possa se sentir confortável em aprender. E também, por via disso, nós termos infraestruturas que sejam atrativas para que o aluno também possa continuar a estudar. E o lanche poderá vir para garantir que não apenas possamos ter aqui a questão do combate da desnutrição, que o país ainda tem níveis muito elevados de desnutrição crônica. Estávamos em 43%, baixamos agora para 38%, mas ainda precisamos de trabalhar ainda mais. Então, não é uma questão de falta de vontade, mas acredito que é mais termos uma lista, um rol de ações urgentes que ainda o setor da educação precisa intervir com o apoio do próprio governo. Mas, mesmo assim, nós temos insistido para que pelo menos possamos ter uma linha orçamental lá. E se nós tivermos essa linha orçamental, poderá ser uma luz para que no futuro nós possamos ter a alimentação escolar em todas as nossas escolas, que é o nosso desejo sempre. Obrigada.
Obrigado pela advocacia, já isso, a mensagem mesmo muito potente. Espero também que vão conseguir. Agora, já que a doutora Arlinda está, já chegamos ao termo do webinar. Gostaria de dar oportunidade durante 1 minuto, para a conclusão, se tem algumas mensagens chaves que pensas que deve passar aos participantes, de uma forma mesmo curta, 1 minuto mais.
Primeiro, nós gostaríamos de agradecer esta oportunidade, que foi muito boa, porque acabamos percebendo e ouvindo aquilo que podemos fazer mais. E também é importante, e esta corrente é importante porque ajuda a despertar a vários governos sobre a importância da alimentação escolar, e nós gostaríamos de ver um reforço ainda mais nesta corrente toda e trazermos mais aquilo que é o comprometimento político de todos os países para juntos olharmos para o desenvolvimento das nossas crianças, porque as crianças são o futuro do desenvolvimento de um país. E muito obrigada.
Muito obrigado, doutora Arlinda. As mensagens estão cá, vamos compartilhar com todos os participantes assim. Obrigado também ao PMA Moçambique. I'm going to switch back to English now. And as I was saying to Dr. Arlinda, we're getting close to the end of this webinar. I wanted to give the opportunity to our distinguished panelists to conclude in 1 minute with what would be their key messages out of there for the participants and beyond when we will be disseminating, of course, the report of this webinar. Who wants to get started? Dr. Ahmed, do you want to start with some key messages? 1 minute maximum.
So yes, maybe just by recalling to the House that we are supporting the school feeding program, and there are many opportunities. So to submit the proposal to the bank, this is one. The second is related to the food security and response program. So it's a comprehensive package of 10.5 billion actually as ICB group that we are providing to our member countries to support so national food security efforts, and we have disbursed so far, as I said, 1.7 billion. And we are really happy, and the countries that have already benefited are Burkina Faso in Africa, are Burkina Faso, Gambia, Niger, Nigeria, and Senegal. So this is also another rooms because, as I said, as overall, it's a big package. And for instance, just to give you an idea, what are we supporting? We are supporting, for instance, procurement and supply of tons of wheat and barley, building food storage capacity, decreasing the processing time to produce ground nuts, and supporting also the subsistence of farmers, and also so supporting the citizen in our member countries to benefit from the food supply and storage facilities. So these are the two big programs that we have. So please feel free to share it with us. Thank you.
Thank you very much, Dr. Ahmed. Dr. Watkins? Dr. Watkins, are you still with us? I just wanted to give you the opportunity in 1 minute to conclude what you would like the participant to keep in terms of key messages. Not sure, maybe, well, we may have a bit of issues also with internet, but I want that I would like to seize the opportunity, unless Dr. Watkins can access against the webinar, connect against. I would like to really summarize a bit what has been said. A lot has been said. We've heard from the rich discussion today that school meals is a key lever for human capital development. It's not only an investment in the education sector, but also an investment in health, nutrition, agriculture, social protection, economic, social, cultural development. It eradicates a lot of this, what affect this cycle of poverty that we said, and really create a very healthy pathway for overall well-being, including social and economic benefits. However, as we know, overlapping interrelated crises, what we call the polycrisis, have led to rampant inflation, increased debt, deteriorated standards of living, which have exacerbated, of course, the fight against hunger and malnutrition. So we have heard from the panelists that there's a lot of programs really helping us to reach a great outcome when it comes to human capital development. So what I want us to keep in mind is school feeding, school meals program will still continue to be a smart investment. But for that to happen, we need to think more strategically, more operationally on what would be innovative, sustainable financing as a solution that can increase the volume, the efficiency, the effectiveness of financial flows that are regular to sustain national programs in support of national governments. So governments will need also to leverage policy levers for resource mobilization, but can also coordinate fiscal initiatives so they can really within that fiscal space. Together also, we understand that new partnerships are needed, alliances, and really happy that the School Meals Alliance coalition that is there will really help leverage all the efforts that are being put together by government and also development partners with new mechanisms and tools to reach those objectives. I would like to thank all the panelists, really, Dr. Omilola, Dr. Ahmed, Dr. Watkins, and Dr. Arlinda for joining us today for what I think you would agree with me had been a very rich discussion. And I want to assure you that the second webinar will be followed by a third one of this series. I hope that we will also benefit from your participation. I want to also ensure that we will share all the presentation, give you access to the presentation, and also of the recording of this webinar. And let me end here by thanking all the team that managed to put together this webinar, particularly WFP SURFAM team around this, the tech, all the programs, the administration, and of course, Sapna, who has been really the key brain behind this webinar. And extend thanks also to the interpretation that has allowed us today to expand the outreach in English, in French, and in Portuguese. So on behalf of SURFAM, I'll give you also, well, I hope I'll meet you next time during this webinar. Feel free to reach out at any time to us. Thanks again for joining us and have a great rest of the day. Merci beaucoup, boa tarde, bonsoir et à très bientôt. Au revoir.